I just wanted to bring a couple of points or some of the key challenges that I see, particularly in my role and in working with my national colleagues in relation to the community services and health industry. Those 4 points I just want to touch on quickly in welcoming you and acknowledging the program, which is a very extensive program. I just want to say some comments about the challenges I see now and into the future are related to making sure the industry is adequately remunerated and resourced, that we have the right skills mix now and into the future, and that includes the skills of the lower level sort of workforce, the home-based workers, and I'll touch on some of that in a moment because I just want to convey some observations that I think our system has become highly sophisticated, but we're missing a lot of that home-based support, caring workforce, and it's a come-to-me system. It's a come-to-my-office system, largely in many areas, not in the respite, a lot of the aged care and the residential-based services, but I'll just touch on that and come back to that shortly. I think the skills mix has to be at that support end, the low, well, I don't want to be derogatory, but that low-level skills area through to continuing to extend our managers and leaders in new areas as well. Innovation in service models. We're seeing a lot of innovation in service models, and I thank Senator Evans for the unprecedented investment in training, but also the federal government for their unprecedented investment in housing and community services and health generally. The national agreements we have with this federal government are bringing more money and investment into these areas than we've ever seen before. So to that virtual presence of Senator Evans, we say thank you and we'll keep it coming. It's certainly been a very important couple of years in terms of, $1 billion on the table for remote Indigenous housing, another $1 billion in Queensland, and similarly in your own states and territories for social housing under the stimulus package. Amazing opportunities that provides through housing to then help people stabilise other parts of their lives. Chris mentioned the training investment, and the list goes on. The fourth point is evaluation of our work. We really need to focus more, particularly to motivate our workforce. You need to know what you're achieving. You need to know what the outcomes of your work are. I, as a decision maker, someone who goes to the Treasury officials and my colleagues to get more money for our industry, needs to have the evidence of what's working. It's improving, but over the 25 years or so that I've been around in the industry, it's slow. It's really slow in my view, and I think we've got to really lift our game in training people to evaluate, training people on the ethics of evaluation and how to do it, and how to do some of the more simple stuff. I'm not talking about PhD exercises on youth justice and outcomes or whatever the area might be. It's really about some exit interviews, some follow-through. Where are people in 6 months' time? Did that domestic violence program help people 12 months on? Has that aged care service really enabled people to be more independent? And there's more of that, and the federal government is certainly helping states and territories invest in more of that, and partly it's tied to grants. But I just want to touch on the importance of doing more of that. And right now in Queensland, we're establishing a Queensland Centre for Social Science Innovation. My understanding is it's a first in Queensland. 5 of our leading universities are involved, and we certainly want to be a world-leading research hub in the social services, community services area. So I'm looking forward to the development of that. But look, let me just quickly go back over those 4 points because they're the areas I just wanted to leave you with some thoughts on. In terms of adequate remuneration, the Queensland Government has actively supported pay equity for the community services sector. We're very keen to continue to support that. We've put up a budget bid, well, we were successful in a budget bid of $414 million a couple of years ago, and that's a recurrent commitment of $125 million. I thank the Australian Services Union, that's my union, for the work they're doing nationally. Some of your states and territory governments, though, are backing away from this. You need to be on their case. If you want to retain and attract and retain a skilled workforce, you really have to focus on that remuneration. So when you get back to your own jurisdictions, you write letters to your ministers and your governments there, because what I'm hearing is some of them are backing off, particularly New South Wales, Victoria and possibly WA. In terms of the investment, our investment has grown over the last 6 years by 160% in the community services area alone. And in mental health and other areas, we a few years ago introduced a new mental health plan with a $500 million commitment. And we've just launched a new community recovery plan. We've been a bit slow in this area. We've certainly focused on acute care in the hospital system. We follow you in some of these areas, and we're certainly keen to do more early intervention work in the mental health space, and we're improving our investment in those areas. But it's so important that the system shifts from the crisis stuff to the early intervention, but that's very hard. But I know many of you in the skills work and the training you're training a workforce for those early intervention type practices and activities, but our system hasn't really been able to fund a lot of that stuff. It's more the crisis sort of stuff. In terms of the innovation in service models, one of the things I've found, particularly in recent times in my role, is a lot of clients bounce around our system. So in terms of skilling up and training our workforce for the future, we really need to be training people to work more cooperatively across disciplines, across agencies, across government, and really get some of the old-fashioned case coordination and assessment and follow-through happening. And I was never a social worker who focused in on casework. I was in the community development stream, and there was always these barneys between the two. And I haven't had a lot of time in the health system specifically, so my focus is a little more on the broader community services sector. But what I'm seeing is a lack of coordinated service models, a lack of coordinated care. Now we're improving in that, and there's some really innovative models in aged care, in health, and in the community services area broadly. But we really need to follow through, give people that opportunity to follow through with them across a range of their complex needs. On average, the research is showing in our Queensland programs, people present with 8 or more complex needs. So for example, one of the new innovative youth programs we funded in Beenleigh actually gives a 2-year commitment to those young people with a full assessment of their goals, what they need to achieve, what they want to achieve, and we work through the cross-agency planning with that. So we need to see more of that and innovation in service models. And finally, given the limits of time, I'll wrap up, but I just want to say, in terms of evaluating our work, we really need to know more about what works. And it's certainly been a stark, message for me, because I'm sort of going into bat for money, and Treasury is saying, well, where's your evidence of what's working? And we get a lot of counting of inputs and counting of some of the outputs or activity-based reporting across our systems, but we don't actually get a lot of the, well, where are people? Has their housing been stabilised? Has their health been stabilised? Are they living independently, successfully? So we need more of that, and we need to provide that to our workforce as well, to motivate them that we are making a difference. With your theme, making a difference, I think if you just look at social indicators alone, you'd be very concerned that we're not making a difference, because things at times look pretty grim when you look at social indicators of health and well-being. But when you get around and you see the day-to-day work that's happening, it's very encouraging. There's great stuff happening in all sorts of organisations and settings right across the board, but it's very hard to get good evidence-based, empirically based information on what's being achieved. And also, one of my concerns is that a lot of our practice these days is being driven by what our IT system can cater for and measure, not what good practice is. Now, I say that and hope it's provoked some thought, because I'm making a gross generalisation, but it's so frustrating when you hear the IT people in an agency like mine say, oh, we can't do that, Minister, because we can't get it into our program. Well, I don't care if it fits into a computer. I want to know how it fits for people's lives and their livelihood. And you think about that, because more and more we're using IT-based systems, client management systems, and in terms of measurement of outcomes, we're using IT systems to measure these categories. And if it doesn't fit into a category, the practice isn't there, you don't do it, and it's very limiting. So at the risk of raising something with a very limited time and just planting a little seed there, I do think we've got to be very careful into the future, in our health system and our community services systems, that you know, our IT people are working closely with our practitioners, because at the moment it's about poles apart, and in terms of practice and skilling, we need to make sure it's not our IT people dictating what our practitioners do. I can't gauge the level of, you know, agreement on that. Does anyone agree with me? Yes. There you go. Well, there's some food for thought. Have a great conference. Thank you.